Hi, I'm Dr. Edward Jones, and I look forward to seeing you at your cataract surgery evaluation. A little bit about myself. I was born and raised in Oklahoma City, did my undergraduate training at the University of Oklahoma, and did University of Oklahoma College of Medicine as well for my MD degree. I then spent 3 years in Birmingham at the Eye Foundation Hospital at UAB for my ophthalmology training before returning to Oklahoma City and starting my practice here in 1995. I've been here ever since and board certified by the American Board of Ophthalmology. For your cataract surgery evaluation, I thought this video might be helpful to answer some questions. A cataract is another name that we give the lens of the eye. The eye is like a camera. The light comes in through the front, through the cornea, focused through the pupil and through the lens onto the retina. The lens, which you normally can't see sitting behind the pupil, can become cloudy. That cloudiness is a natural part of aging and can also be caused by certain diseases. When that happens, we simply give the lens another name and call it a cataract. This causes blurred vision and is the reason for the cataract surgery operation to remove it. We do cataract surgery as an outpatient procedure. It's at a surgery center. It's a same-day procedure. You will need someone to drive you, and we'll have other instructions for you for your day of surgery. Basically, you will be checked in. You'll have an anesthesiologist to give you relaxing medication so that you'll be nice and relaxed in kind of a twilight sleep for your cataract surgery. We'll do one eye at a time, usually a week or two apart. The surgery involves a small incision, which, as I mentioned, involves the removal of the lens, which is called the cataract, and then the insertion of the new lens, which is a plastic, man-made material. The cataract lens can be simply a basic lens, or we have other options to reduce your dependence on glasses with specialty lens implants. These lens implants can be focused for distance vision to relieve you of the need for glasses for driving and only requiring reading glasses. Or we also have options for the full correction to correct distance, computer, and near vision without glasses, only needing glasses for the very tiniest of near vision. All of these options will be discussed with you at the consultation, and of course we look forward to answering any questions you might have. Some patients are a candidate for any and all of these new technologies, and some patients are restricted by other eye diseases that they may have. Cataract surgery is the most common surgery performed in the United States, so it has very low risk, but it is a surgical procedure, and I always say that with any surgery there are risks. There are also side effects. Side effects are more common than major complications. Side effects may include some temporary redness, scratchy, irritation, all things that heal as to be expected with any surgery. However, there are risks of infection, bleeding, dislocated lens, retinal detachment. All of these things are extremely rare and occur in less than 1% of cataract surgeries. Cataracts do not reoccur, but your body may place some scar tissue behind the implant that we place in your eye that will necessitate a laser procedure in the office called a YAG laser. This is not a complication and is a very common post-surgical thing that could occur anywhere from 3 months to several years after the cataract surgery. At your visit here, we'll go more in depth into the instructions for your surgery, both pre-op and post-op. There will be eye drops involved, and there will be post-operative visits, usually with your local optometrist, although sometimes with our office here. So I hope this video has been helpful in answering some of your questions. We look forward to seeing you for your preoperative consultation, and thank you.
So, Dr. Jones, what is the most common question you get from your patients?
The most common question I get is, am I Edward Jones, the financial company? And no, unfortunately, I'm not. But I will take excellent care of you and fix your cataract. Thanks.
Thank you.